Good day and welcome. I am OLAYEMI DUROTOYE. Today, in conjunction with El Gracia Child Health Foundation, Ogun State, I'll be speaking about seizures in children. The brain is a bundle of wires, if I can put it that way, that produce electrical activity that control our body. So seizures are abnormal neuronal activity or abnormal electrical discharges from the brain which manifest in the body. Seizures in children can be a very distressing and frightful experience, especially for parents, teachers, and caregivers. And many wonder, how did this happen? Because most times the child can be a well child who has been playing or carrying on with his activities and then starts to manifest abnormal seizure activity. So, be that as it may, we need to know what seizures are, what causes them, and what can we do to a child who is having seizures. Like I said earlier, seizures are abnormal electrical activities that take place in the brain, and they are of two broad classifications: the focal seizures and the generalized seizures. The focal seizures, as the name implies, happen in one part of the brain, a particular focus, which then manifests on one side or one part of the body. Usually, focal seizures are characterized by abnormal movement of one part of the body, either jerking or shaking or twitching of one part of the body, while generalized seizures involve the whole of the brain and then affect every part of the body. And then in generalized seizures, in focal seizures, the patient will not lose consciousness. The abnormal activity may be taking place while the patient is awake and sometimes even alert. But in generalized seizures, the patient usually will not be aware of the surroundings. Before I go further, let me talk about febrile seizures. Febrile seizures. And the reason is because for children, especially in this part of the world in which we have a lot of febrile illnesses, the child may just start convulsing or start showing abnormal muscular activity when the child has a fever. Febrile seizures usually happen in the setting in which a child has a fever and then has a generalized seizure. The child has a generalized seizure. And this is usually very frightening to a lot of mothers. And then on the other hand, we have afebrile seizures in which the child doesn't have any fever, may be carrying on with activities, and suddenly starts to manifest seizure activity. Now, let me say that what people usually call a seizure is when somebody falls to the ground and starts moving the one part of the body, or every part of the body starts to jerk, or the person starts to foam from the mouth. You're trying to call the person and the person is not responding. I say that is just one form of seizure activity. There are other forms by which a seizure may manifest in a person, just like I said before, either as a focal seizure affecting one part of the body or as a generalized seizure affecting every part of the body. Now, for generalized seizures, the person may just be staring, maybe blinking, maybe twitching one part of the mouth, or just jerking one part of maybe the fingers or the legs, or just have some abnormal activity. But what distinguishes between a focal seizure and a generalized seizure is the fact that is the person aware of the environment? That means, is the person conscious or is the person unconscious? So, and then there is this term that is loosely thrown around in the society, and that word is epilepsy. Is one word that many people, because of our African culture, do not even want to hear. Epilepsy is what we refer to as epilepsy is when a person has recurrent seizures. or the brain has the tendency to have abnormal neuronal activity is what is called epilepsy. It's a chronic condition of the brain in which whatever form of seizure the person manifests, it keeps happening over and over again. In this kind of session, especially in children, there is no fever, there is no infection. The child is fine and carrying on with his daily activities, but just manifests this kind of abnormal brain activity from time to time. It's very important for parents, especially caregivers who are in close contact with children, teachers, to be able to identify what a seizure activity is. Because many times when people come, especially to the clinics, you see them, they have one form of abnormal movement or abnormal behavior or the other. When you ask the parents, they don't even know. They haven't even noticed over time. But one is able to pick that this child or this person has this abnormal seizure activity. So, like I said earlier, it's not only when somebody falls to the ground and starts to foam from the mouth that the person has a seizure. I don't want to go too deep into all the medical classifications and all the so that we don't get thrown off balance as we carry on. Now, I want to talk about febrile seizures, which is more common in this environment because we have a lot of um, febrile illnesses in children that may lead to a convulsion. And so, what happens in febrile convulsions is that the child's temperature is so high that the thermostat in the brain has already been overridden by the high temperature, leading to a disarray of all the function of the neurons in the brain. And so it begins to manifest as excessive or jerk-like muscular activity in the child. And in this kind of situation, usually in the setting of a fever, when the temperature, the seizure, of course, is aborted in a healthcare setting, the seizure is first of all stopped because then that is very important because the more the child has the seizure, the more injury it gives to the brain. So the seizures are first of all stopped, and then the temperature is brought down. Then the cause, the underlying factor that led to the fever is identified, and the child is treated of it, and then the seizures they stop and they don't even come back. They don't come back again. So, in the setting of febrile seizures, usually common in children between the ages of 6 months up to 5 to 6 years, and then the child has it in the setting of a fever, has just about 1 or 2 episodes in the duration of the febrile. That's for simple febrile seizures. So, but for complex febrile seizures, the child has fever, but then goes on to have um, repeated convulsions in a 24-hour period. That's what we call complex febrile seizures. And children who have this usually will have the tendency to have recurrent afebrile seizures, which we refer to as epilepsy. So, what do we do? Try to prevent our children from having infections. And then, when you see that the child has a fever, immediately you administer an antipyretic, that is to bring the child's temperature down. And then when you give an antipyretic and you've given maybe 1, 2, or 3 doses and the fever persists, it's time for you to head out to your healthcare facility to find out what the cause of the fever is, because many children will not even convulse when they have fever initially. It's when the cause of the fever is not well taken care of and the fever goes so high, that's what usually will lead to a febrile convulsion. Now, because of my time, let me just quickly talk about the other part, which is the recurrent afebrile seizures, or what we refer to as epilepsy. Epilepsy can manifest in different forms. There are different classifications of epilepsy, and there are different manifestations of epilepsy, and what we even refer to as the epilepsy syndromes. But because this is not a neurology class, I'm not going to delve so much into all the different classifications and what to do about them. But let me talk about the generalized seizures, the most common one, which is the generalized tonic-clonic seizures, in which a child just suddenly may just scream out from sleep or may just be carrying on with the daily activities, suddenly starts to jerk. For some children or some young adults, it may start as a focal seizure, then become secondarily generalized, or it may just start as a generalized seizure. Usually the person will fall to the ground or have an aura, what is called an aura, in which the person already knows that this thing is about to happen. For some people, you just see them when they have that aura, maybe they start to perceive a strange smell, or they start to feel lightheaded or dizzy. Many will just withdraw from the environment, and then they go to lie down somewhere, and then that episode just passes. But for some, it goes to become a full-blown seizure activity, jerking of the hands, of the limbs. There may be frothing from the mouth in some people. There may be loss of sphincteric tone, in which the person may either pee or sometimes even poo on themselves in some kind of situation. So this lasts for some a short period, some may last for as much as 3 to 5 minutes, and then after that, they go into what is called the post-ictal state, in which the person just sleeps off, is in deep sleep, and then after a while, then they wake up. And then some people, when they wake up, they may not be aware of the event, they may not be aware of their environment, but some may actually be. So what do you do when a person, a child, an adult, a young adult is convulsing? This is very important because I have seen so many things being done to children or adults when they are convulsing. A lot of funny things which are needless, and many of them could even be harmful to the person having the seizure and to the people all around. So the first thing to do is do not panic. Like I said earlier, a seizure activity is usually a frightful event. Most people, they panic, they start to do all sorts of things when someone is having a seizure activity. So the first thing to do is do not panic. And then when you identify that this person is having a generalized seizure, clear the person away from any harm. Maybe the person may be near a gutter, maybe by the roadside, it may be maybe in a classroom, the person has fallen. Clear the area, first of all. So number one, do not panic. Number two, clear the area. Number three, do not insert any object. Any object, your finger, a spoon, a wooden stick, do not insert anything into the person's mouth. And the reason is because when a person is having seizure activities, the culture around us believe that when the person clenches the teeth, it means the person is going to die. But that is not true. The clenching or the grinding or the locking of the jaw at that time is part of the seizure activity. So if you peradventure put your finger in the person's mouth and the person clenches the teeth on your finger, we can jolly well say bye-bye to that finger. Because at that time, if the teeth is clenched on that object, I pray it's not a finger, the person may lose that finger. And then if you put a spoon, a stick, because of the hardness, the locking of the jaw at that time, the person may break whatever that object, and it may injure the oral structures, the tongue, the roof of the mouth, even the throat in some situations. So what to do is to turn the person to the left side, the left lateral side, such that the tongue falls forward. Some people, what they try to prevent the person is to prevent person from choking, and then for the tongue from falling backwards, and so that it doesn't block the airway. That's for a good cause. But in that kind of situation, you really can't get anything. Really shouldn't get anything into the patient's mouth. So you turn the patient to the left lateral position as shown in the picture, to allow the tongue to fall forward so that it doesn't block the airway and it doesn't get trapped in between the teeth, because I've seen cases in which the tongue gets trapped in between the teeth during a generalized seizure, and part of the tongue is actually cut off. So you place the patient on the left lateral side and wait for the seizure to abate. Most seizures will abate spontaneously without any intervention. So that's not the time to start pouring water on the patient's head or start pouring sand on the patient's body or start, screaming and shouting, and just allow the patient to be in that state until the seizure abates, or until the patient can be lifted, maybe put in a vehicle and taken to a healthcare facility. And of course, if it happens in a healthcare facility, there are many agents that we can put in place to abate the seizure. So that is what to do when a patient is having a generalized seizure, and which is, the commonest type of seizure that people know. But I must also say at this point that there are different types of seizures. For example, in children, there is what is called the absence seizure. Absence seizure is a generalized kind of seizure that may even pass without anybody noticing. And what happens in an absence seizure is that the patient is just staring into space, and it's a generalized seizure such that however you try to rouse the person or get the person's attention at that time, the person is not aware of the environment. And because it is fleeting, it happens, lasts maybe about 30 seconds to 1 minute, the patient just snaps out of it and carries on with their activity. So many teachers or many parents will come to us and then they say this child is falling behind in the grades, this child is falling behind in one thing or the other. And then we find out that it's because the patient has been having so many episodes of absence seizure, even during their daily activity. So they are not able to carry on or to catch up with what they are being taught, especially in the classroom. So if a child has several episodes of absence seizure in the classroom, they are not able to follow what the teacher is saying. So that kind of child, of course, there are ways by which we can manage that kind of situation. I must also say that about epilepsy, people who have epilepsy should not be stigmatized because it's a condition that can be well managed. It's just the culture and the tradition around that says that a person with with epilepsy, you shouldn't touch the person. Their saliva must not touch you. You can't get married to the person. They are limited in life. No, that's not the situation. Epilepsy can be well managed without any problems, and a person living with epilepsy can carry on to live a very, very fulfilled and productive life. So what do we do if one gets a diagnosis of epilepsy or a diagnosis of febrile convulsion? Let me start from there. Febrile convulsion, like I've said before, will happen in the setting of a fever. And then once the fever is gone, the patient can carry on with their normal lives. And so what we do is that when a child has that condition and the condition is over, we advise the parents. The moment this child has a fever, don't wait, because the child has a tendency to convulse. So immediately you give an antipyretic and then you go to your nearest healthcare facility. And for some children, we even give them prophylaxis, anticonvulsant prophylaxis, to prevent them from having a seizure. Then what do we do about the generalized seizures, the different epilepsy syndromes, whatever diagnosis is given? What to do is to visit your healthcare facility, and then there are medications that can be used to manage epilepsy and manage them effectively. The reason why I'm saying this is because just like we know what led to the epilepsy, which is abnormality of neuronal activity in the brain, there are medications that we give to abate or to bring down those disarray of neuronal activity and to make the patient's brain to function normally. So we give medications, we give other therapies that we use also to manage epilepsy. So I know I don't have so much time now. Being able to touch on just a few points about epilepsy, just to demystify it and to let us know that it is not a thing of a taboo, or people who have epilepsy should not be taught, they should not be talked to, or they should not even get married or have children. That is not the case. It is a medical condition that is amenable to therapy. And many people, after a long time, we declare them free of this epilepsy. When they have used their medication, they remain seizure free for a long time. We even tail down on the medications, and then we take them off it, and then they continue to live their lives. So please, parents, mothers, caregivers, when a child is having a seizure, no onions in the face, no water, no boiling water, putting the legs in fire. That is not what to do. Though that will not stop the seizure. What to do? Turn the patient to the left lateral space. Make sure that the airway is open, and then you head to the nearest healthcare facility. Now, some people may want to ask me, because I've been asked several times, what causes epilepsy? For some, we know the cause. When we do imaging of the brain, we may find one or two structural problems that might have led to the epilepsy. But for some people, we do not find any structural problems. It's just a disorder of the function of the brain. And so, in this kind of situation, we give medications, and then the patients do well. Thank you very much for listening. There's room for questions and comments. You can always contact or send us your questions and your comments, and we'll gladly oblige you. Thank you for listening to this program.